Gas, groceries, housing, healthcare. What does the government have the most control over? Healthcare costs. Some of them are directly negotiated. They are lobbied heavily by the industry. Why? Because there's a lot of legislation involved. And the costs there are crushing us. They're growing faster than inflation. 4 in 10 Americans with insurance still carry medical debt. 4 in 10 Americans with insurance still carry medical debt. Costs are the problem, not access. Doctors see the problem up close. Dr. Jamie Seeman has decided to take on this problem as it savages her practice, and she sees it all around, and she's brave enough to talk about it. Doc, great to see you again. All the best to you and the kids and your husband for the holy days.
Thank you. Great to be here, Chris.
So when you hear about costs and why they can change, what do you see that others do not?
Well, something I have been saying for years, the cost of healthcare in the United States, the real answer, this real solution is that it doesn't value prevention. Preventative medicine, prevention of getting sick in the first place is totally undervalued in the system. But the costs are insane. We spend more money in the United States of America than any other country in the world, and the quality of our healthcare and our health in general is worse than many other countries. Part of it is the transparency of the prices. They're completely inflated. As an example, if somebody has a heart attack tonight, they're not going to stop by 4 or 5 different hospitals and ask which cath lab is the cheapest, right? They're just going to access the care. And this is all set by the institutions, by the insurance companies, by the hospitals. They have a master list of what they're going to charge for things. And depending on your insurance, if you have insurance or not, the price of that is going to be different. The charge master price for getting your appendix removed, Chris, is going to be $50,000. But Blue Cross and Aetna and United are all going to pay a different negotiated price that they've negotiated with the hospital system. And so there's not transparency to patients. A lot of doctors don't even understand our extremely complex billing and coding system. It's just gotten completely out of control.
So the easy answer, they say, is competition. All you need is just more competition. Do you believe in that? Because the business is going the other way. It's consolidating. But what is the but when it comes to competition?
Well, it is consolidating. For instance, hospital systems are merging. Private equity is now coming in and buying private practice physician clinics like my own, and that increases their profits 10 to 30%, and it does not increase the quality of healthcare that is coming back to the patient. So competition is good, but the whole system is a monopoly. The pharmaceutical companies, the insurance companies, the pharmacy benefit managers, those are the people that are profiting. And the insurance companies are profiting billions with a B, Chris. We're talking a large amount of money. A lot of people say, that the doctors are, raking people over the coals. I can promise you, it is not the nurses and the doctors and the people that are actually providing the care that are benefiting in any way.
So give me the pushback on that, Doc. The doctors get paid more in this country than anywhere else. I mean, they're part of the problem. Yes or no, and why?
Well, what they've forced the doctors to do is this is a fee for service. So you are incentivized to be high volume and high procedure. The more patients that you can mill through the clinic, the more patients you can get through the hospital in and out of the operating rooms with efficiency and do it quickly, the profit is higher. But, I went to medical school. I have skills and assets. I'm a surgeon. I have value that I can bring to the patient. And of course, we all deserve a paycheck for what we provide. But when you're talking billions of dollars in profits at a really high level, and my own premiums went up this year. I mean, for my family, my premiums darn near doubled this year. I get it. My own mother was a healthcare administrator. I know this problem through and through. And healthcare administration costs are almost 25 to 30% of our healthcare system. So just to administer the care that I provide to my patients, I mean, we're talking an insane amount of paperwork and clicking just to provide the care. It's just crazy.
So how frustrating is it to you to see that the state of play is whether or not to extend the subsidies when I'm not saying we don't need the subsidies. I get how many people need the subsidies, but the reason they need them is because of the cost structure, and that's not even really part of the conversation.
Taking care of Medicare and Medicaid patients, obviously I see patients that come from all walks of life, but reimbursement is set by the government for Medicare and Medicaid, and then private insurance companies use those numbers to determine how much they will pay us. So every time the government starts lowering reimbursement for Medicare and Medicaid, it makes clinics like mine shudder a little bit because it's going to continue to just pinch our pockets as much as it can. Medicaid patients in the state of Nebraska, our office actually loses money administering care for these patients. So we're really, we call it moral injury, Chris. We came into medicine because we want to help people, but we're working in a system that just is, it's kind of sickening to look at the amount of profit that's being made off the backs of physicians, healthcare providers, and ultimately the patients, all of us, everybody listening.
Well, I'm staying on it, Doc, and I appreciate your bravery because let's be honest, it's not as easy to work within a system if you're talking about what's wrong with it. I appreciate you doing it, and I am here for it. You'll always get a platform on my show to discuss it, and I'm going to keep the issue up there. So thank you for being with me.
Keep working out, Chris. Stay out of the doctor's office.
I need it. I need it. All right, I got the hint, Doc. I got the hint. Dr. Jamie Seeman, thank you very much. Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.